It's all on the line right now. It's on the line for the White House, for President Obama, and for the Democrats in the Congress. They're not at that 216 yet.
How do you think she gets to 216?
How much pressure is the House Democratic leadership putting on their members?
Democratic leaders on the Hill try to convince their rank and file to vote for the Senate version of the bill.
Asking a lot of your colleagues to walk off a cliff.
Try to put the pressure on them for the final closing vote.
They are trying by any means possible.
Intense pressure tonight is on the 37 House Democrats who voted no on the House health care bill in November and are now being pushed hard to vote yes.
Deal making and kickbacks and pressure has really been the norm of getting health care passed.
So House leaders are busy twisting arms.
Arm twisting.
What's arm twisting? What's bribery?
The arm twisting and the pressure.
A lot of arm twisting.
I have not been given any updated information that leads me to believe that March 18th isn't a doable day.
March 18th is an interesting day.
We don't feel that we want any deadline assigned to us.
If it takes a couple extra days after a year, it takes a couple of extra days.
It's looking more and more likely that the president's latest deadline is going to come and go.
Healthcare reform trumps President Obama's overseas trip. He has delayed his trip to Guam, Indonesia, and Australia by 3 days.
The president will not be going on this trip because it would be a big mistake. And sure enough, the news comes out, he's staying.
The special deals that the president found objectionable are indeed out of this legislation.
So none of the things that are state-specific to win the votes of individual senators, Louisiana not counting as that, but none of the others will be in the final bill.
The principle that we want to apply is that are these applicable to all states?
Bernie Sanders, Chris Dodd, and John Kerry have all said, we want our special goodies left in.
The Louisiana purchase. Then there's the Cornhusker kickback. Vermont and Massachusetts get more than $1 billion in extra Medicare payments. And then there's a hospital handout where Senator Chris Dodd of Connecticut arranged a $100 million earmark. Gatorade, it's $3 to $5 billion in federal spending that protects Florida seniors.
Congresswoman Scavenaghan, how would you describe your relationship these days with Speaker Pelosi over the health care issue?
I would describe our relationship as one in which she has, I think she would respect my decision-making process, and one in which she probably acknowledges that I have some disappointment on how this process has unfolded.